I know that I saw a video that talked a little bit about you had to actually leave Canada to get treatment
Mhm.
elsewhere. Is there anything you or like share a little bit about that experience, like what led you to do that?
Yeah, like, it was so tricky because, like, when I mentioned the injury and it getting worse, I realized I spent the years after that kind of paralleling the medical system. So I'd go for, like, treatments, I would do, like, lifestyle, health,
Mhm,
body, all these things, but I kinda ended up veering away from the general medical system, not because I'm opposed to it, I think it has some
mhm,
really valuable pieces, but because it just felt like they didn't understand me, and I didn't know that I had this very relevant mechanical piece that was affecting me so much neurologically.
mhm,
So I kind of paralleled that, but then when I started having very acute, like, stroke-like symptoms and whatnot, I had to go back into that medical system, and I saw, that many more specialists, but it felt like this condition there isn't it's not that it's not valid, it's that there's no
mhm.
placeholder for it. So when a condition doesn't exist within their criteria, where do you go as a patient? And yeah, so I ended up like also doing like visual vestibular rehab and whatnot. And that specialist, which was also um, private care, was like, something's really wrong with you. Like, you're not making
Mhm.
your milestones. There's things that are getting worse. Like, something's really up. And he recommended I see a local specialist who does dynamic imaging.
Mhm.
And that's where I got diagnosed. So it's one of those interesting pieces where when I would go into the medical system, like I like the first time I had like tremors and vision loss and paralysis for a few days,
Mhm.
I ended up in an emergency, but and they always thought I had MS, and that I was
Okay.
having a major like occurrence. But then my brain scans didn't look like MS, so they were like, "We
Mhm.
don't know what to do with you." I would kind of come back out of it, feel lost, and then I'd also feel like I was becoming so fragile that every time I got in a car, went to a medical setting, or actually out and about,
Mhm.
I was becoming more and more compromised. So it started to be like, how do I manage this? So when I got diagnosed, I was, still seeing specialists, but even when I got that information, I would bring it to the local specialists and they were like, we don't know what to do with this. Like, we don't
Mhm.
understand how this condition is related to what your symptoms are. And so, yeah, like the long story short is like I got more and more desperate. My condition became so acute
Mhm.
that I was having, really serious conversations with those closest to me because I think that when I don't know if this is too heavy, but when your body is breaking down in a certain way, like you kind of know it and it's not fear based, it's not panic, it's just you can kind
Matter
of
of
tell.
fact. Mhm.
Yeah, and I felt like, okay, like I have to make responsible choices. I have to think what's going on. And the specialist who diagnosed me put me in touch with other patients who, like, one was diagnosed with ALS, another one like just really serious things. But it ended up
Yeah.
being that this condition was like, I don't know if it was like masking as the symptoms or whatnot, but this condition was the root of a majority of what was going on with them. And they
Mhm.
traveled for surgery. So that kind of started to prime me to be like, okay, like I'll look into it. And then I kept thinking, well, if it gets bad enough, I'll get the surgery. So like I'm not getting the surgery because it's not medically necessary, not realizing that
Right, and you wanna
this
avoid that if you can. Yeah.
totally. And I also wanted to, I knew it could make me much worse.
Mhm.
And it was just such a strange thing too, because I think that unless you've dealt with complex health, you don't realize how many gaps there are in the system.
Mhm.
And also sometimes too that the system acts too late. A lot of what I've learned is hindsight. So I went into
Mm,
this,
mhm.
it became so severe. I didn't understand what was happening. And then it got to the point where I knew that I didn't have anything left to lose. And so I
Mhm.
essentially like did my research and had like a world leading neurosurgeon take me. So I did that.
Yeah.
And the tricky thing is like in all the research I did before and after is that this region of the body is so tricky to treat. Outcomes can be they're not always good.
Mhm.
Neurosurgeons will avoid it at all costs. So having him take me on gave me my best chance. And I've had a huge improvement from the surgery. And yeah, so it,
Wow, I mean, that's really like, I'm really glad to hear that you were able to get that procedure and go that route because I know that there is the program as far as like, assisted, I think it was called MAID, if I'm not mistaken, in Canada, right? Like that seems to be, I don't know. I guess that's a very complicated, individualized decision
Mhm.
and place to go, and so I just feel like going the other route where try everything possible to keep going,
Yeah.
is,
And that's the reality for a lot of patients with the
yeah,
severe forms of this condition is we keep thinking, and at some point it will change, but we keep
yeah.
thinking that the system will intervene, but there's no net for patients like us. And